Hey, it's Crystal, and I am so excited to be chairing this conference for and about neurodiverse physicians. We know that 1 in 5 people are neurodiverse, so that means I know that there are patients in your practices who are neurodiverse, who may not even know it, who may know it and may not think it impacts their healthcare, and so don't disclose it. But we're going to talk about some of the different neurodiversities and how they can or potentially can impact your treatment plan.
My presentation will be on sleep strategies for neurodivergent physicians. We'll talk about how the unique gifts and challenges affect sleep and strategies to overcome sleep obstacles.
And I'm excited to share about mindfulness, how to quiet the chatter in your mind and feel more calm and present.
Neurodiverse physicians are some of what make our field so rich, but psychiatric illness can still happen and actually happens more often. Having a different brain predisposes you to problems and changes some of our novel treatments. In my lecture, you'll learn what those treatment options are, how they differ in people with neurodiversity, and how we can differentiate burnout from actual psychiatric illness.
Whether you have ADHD or not, you can join my class to learn how to optimize your executive function and end procrastination loops.
As I've learned more about ASD, I've come to realize that there's a huge portion of my clinical population who meet criteria for this diagnosis but have never been formally diagnosed. Many of these patients are not being diagnosed because so many clinicians don't feel comfortable making the diagnosis. So there are a lot of people out there who are on the spectrum but don't know it. They know they're different, but they don't understand why. And that's what I'm going to be discussing with you.
As a pediatric neurologist, I spend a lot of time thinking about brains, how they work and how they're wired. It's important to remember that this concept of normal or neurotypical is not a value judgment. It's just the most common type of brain, so that's the kind of brain that society is structured around. Think of it as being right-handed or left-handed. Righties make up about 90% of the population, and most of the time we don't even notice how much of the world is built for us. However, I can guarantee that the lefties, who make up 10% of the population, absolutely notice because they have to work harder to fit into a world that was not built with their needs in mind.
It was only after my own later in life diagnosis of ADHD in my 40s that all of this really became clear to me. I am so excited to draw from both the current medical literature as well as my own personal experience to share this with you so that you can begin to better recognize and support your colleagues who may have ADHD, and that includes yourself as well as perhaps people that you're leading if you're a physician leader.